Hello, is this thing on? Hi. Cardiovascular and Circulatory System, Chapter 6. Case report. You are a cardiovascular technologist employed by the Cardio Department of Fullwood Medical Center. You have been called to the Emergency Department, ED, to perform an electrocardiogram, ECG or EKG, STAT. You are communicating with Mr. Hank Johnson, a 24-year-old owner of a printing company. 8 months ago, he had left a total hip replacement. In the past 3 months, Mr. Johnson has returned to his daily workouts. This morning, while riding his exercise bike, he felt a tightness in his chest, but continued cycling. He developed pain in the center of his chest, radiating down his left arm and up into his jaw, and became diaphoretic. His personal trainer called 911. You perform the ECG, and the automatic report describes abnormalities in the chest leads. As you remove the electrodes, Mr. Johnson complains that he is feeling faint and having difficulty breathing. You are the only person in the room. The health professionals involved in diagnosis and treatment of problems with the cardiovascular systems include the following: cardiologists are medical doctors who specialize in disorders of the cardiovascular system. Cardiovascular surgeons are surgeons who specialize in surgery of the heart and the peripheral blood vessels. Cardiovascular technologists and technicians assist physicians in the diagnosis and treatment of cardiovascular disorders. Vascular technologists are practitioners who assist physicians by performing diagnostic and monitoring procedures using ultrasound. Cardiac sonographers or echocardiographers are technologists who use ultrasound to observe the heart, chambers, valves, and blood vessels. Phlebotomists or phlebotomy technicians assist physicians by drawing patients' blood samples for laboratory testing. Perfusionists are highly trained healthcare professionals who use the heart-lung machines during cardiac and other surgeries that require cardiopulmonary bypass. Lesson 6.1: The Heart. Location of the heart. It is important to know precisely where the heart is located so that you can perform effective cardiopulmonary resuscitation, CPR. The heart is located in the thoracic cavity between the lungs, in an area called the mediastinum. The heart is shaped like a blunt cone, pointing down and to the left. It rests at an angle with the majority of its mass to the left of the sternum. Functions of the heart. In order to keep your body alive, your heart must work all the time without stopping. Its three most important functions are to pump blood, route blood, regulate blood supply. Pump blood. As your heart contracts, it generates pressure that moves your blood through your blood vessel. Route blood. Your heart essentially has two pumps, one on the right side that sends blood through the pulmonary circulation of your lungs and back to the second pump on your left side, which sends blood through the systemic circulation of your body. Your heart valves make this one-way flow of blood possible. Regulate blood supply. The changing metabolic needs of your tissue and organs. For example, when you exercise, are met by changes in the rate and force of your heart's contractions. A little physics there, huh? Structure of the heart. The heart wall consists of three layers: the endocardium, which is connective tissue lining the inside of your heart; the myocardium, cardiac muscle cells that contract to enable your heart to pump blood; epicardium, an outer single layer of cells overlying a thin layer of connective tissue. The pericardium is a double-layer connective tissue sac that surrounds and protects your heart. Blood supply to heart muscle. Because your heart beats continually and forcefully, it requires an abundant supply of oxygen and nutrients. To meet this need, your cardiac muscle has its own blood circulation called the coronary circulation. This system of arteries arises directly from the aorta. If any of your coronary arteries become blocked, the blood supply to a part of your cardiac muscle is cut off, ischemia, and the cells supplied by the artery die necrosis within minutes. This is a myocardial infarction, MI, or heart attack. Blood flow through the heart. Your heart has 4 chambers through which your blood flows. These chambers are right atrium, right ventricle, left atrium, left ventricle. Your right and left atria are separated by a thin muscle wall called the interatrial septum. Your right and left ventricles are divided by a thicker muscle wall called the interventricular septum. Your left ventricle pumps blood to all parts of your body except the lungs through the systemic circulation. Oxygen and nutrients are delivered to your body cells, and carbon dioxide and metabolic waste are removed from the cells. This deoxygenated blood via the veins returns to the heart, where the right ventricle pumps blood into the pulmonary circulation to the lungs. In the lungs, the carbon dioxide waste material is exchanged for oxygen from inhaled air. This oxygenated blood then travels through the pulmonary veins back to the left side of the heart. You have 4 valves that work together to ensure correct flow of blood through your heart. On the right side are the tricuspids and pulmonary valves, and on the left side are the bicuspid and aortic valves. See, you study like stuff here. The heart's beat. The actions of the 4 heart chambers are coordinated. When the atria contracts, atriosystole, the ventricles relax, ventricular diastole. When the atria relax, atriodystole. When the atria relax, atriodystole, the ventricles contract, ventricle dystole. Then the atria and the ventricles all relax briefly. This series of events is a complete cardiac cycle, or heartbeat. The lub-dub, lub-dub, lub-dub sounds heard vary through the stethoscopes are made by the heart valves snapping as they close. If there is an abnormality in valve closure, it will produce an extra abnormal sound called a murmur. Electrical properties of the heart. As your heart muscles contract, they generate a small electrical current that sustains your heartbeat rhythm through a conduction system. Here is how this conduction system works. A small region of specialized muscle cells in the right atrium, sinoatrial node, initiates your heartbeat. The SA node is the pacemaker of your heart's rhythm. Electrical signals from the SA node spread out throughout the atria and rejoin at the atrioventricular node. The AV is the electrical gateway to the ventricles. Electrical signals leave the AV node and travel to the ventricular myocardium, where they stimulate ventricular myocardium to contract, creating your heartbeat. Wow, okay. Sinus rhythm. Sinus rhythm is a term used to describe a normal heartbeat, when normal electrical conduction leads to a ventricular rate about 60 to 80 beats per minute. An abnormal cardiac rhythm is called arrhythmia or a dysrhythmia. An electrocardiograph is a device that picks up the heart muscle electrical changes and amplifies them to record an electrocardiogram in the form of waves. Interesting. Disorders of the heart. You are an EMT/P called to the gymnasium of Fullwood University. You are communicating with Danny Gitlin, a 21-year-old guard on the university basketball team. Danny lost consciousness during a strenuous practice. He had no pulse but was revived by the coach, who used an automatic external defibrillator, AED. Danny has never lost consciousness before, but he has noticed episodes of rapid palpitations after games. On examination, he is fully conscious and appears to be fit. His pulse is 70 but irregular in rate and force. His blood pressure is 110/65 mmHg. He has no known family history of heart disease. Disorders of the heart. Abnormal heart rhythms. Arrhythmias are abnormal or irregular heartbeats, and 6 types are commonly seen. Premature beats occurs most often in elderly people and are usually associated with caffeine and stress. I'm getting old. Atrial fibrillation occurs when 2 atria quivers rather than contract correctly to pump blood. This causes blood to pool in the atria and sometimes clot. Ventricular tachycardia, VTAC, is a rapid heartbeat occurring in the ventricles. Ventricular arrhythmias include premature ventricular contractions, PVCs, which results when extra impulses arises from a ventricle, and ventricular fibrillation, VFib, which occurs when the ventricles lose control, quivering instead of pumping. Heart block occurs when interference in cardiac electrical conduction prevents the atria's contraction from coordinating with the ventricle's contraction. Palpitations are brief but unpleasant Palpitations are brief but unpleasant sensations of a rapid or irregular heartbeat. They can be brought on by exercise, anxiety, and stimulants like caffeine. Arrhythmias can be treated with medications, but some patients require mechanical pacemakers. Pacemakers consist of a battery, electronic circuits, and computer memory to generate electronic signals. These signals are carried along thin, insulated wires to the heart muscle. Pacemakers are ideal for patients with a very slow heart rate, bradycardia. Brady means slow, I think. Emergency situations, external defibrillation is performed throughout automatic external defibrillators, or AEDs. AED sends an electronic shock to the heart in order to stop the heart temporarily so that a normal contraction rhythm can resume. This procedure was used for Danny Gitlin. People with life-threatening arrhythmias may need an implantable defibrillator, ICD, which senses abnormal rhythms. An ICD gives the heart a small electric shock to return to its rhythm to normal. Defibrillation is the non-synchronized delivery of energy to the heart during any phase of cardiac cycle used in emergency situations. Cardioversion is the delivery of lower levels of energy synchronized to the large R waves of the QRS complex, and is mostly used for AFib or flutter and VTAC. Disorders of the heart. Continuing. Disorders of heart valves. The heart valves can function in 2 basic ways. Malfunctions most often occur in the heart's left side. Stenosis. The valve cannot open fully, and its opening is narrowed, constricted, because blood cannot flow free through the valve. It accumulates in the chamber behind the valve. Incompetence or insufficiency is a condition where the heart valve cannot close fully, allowing blood to leak or regurgitate flow back through the valve of the heart chamber from which it came. Mitral valve stenosis can occur following rheumatic fever. Because the blood cannot flow freely through the valve, the left atrium becomes dilated and enlarged. Eventually, chronic heart failure results. Mitral valve prolapse occurs when the cups of the valve bulge back into the left atrium when the left ventricle contracts. This allows blood to flow back into the atrium. Aortic valve stenosis is common in the elderly when valves become calcified due to atherosclerosis. Blood flow into the systemic circulation is diminished, leading to dizziness and fainting. The left ventricle dilates. Hypertrophy ceases to beat strongly and ultimately fail. Aortic valve incompetence initially produces few symptoms other than a murmur. Eventually, the left ventricle is unable to cope with the excess volume of blood and fails. When a valve replacement is necessary, there are two types of artificial valves available: mechanical or prosthetic valves, which are made from metal alloys and plastics. Tissue valves, which can come from a pig or cow, a human cadaver, or a patient's own pericardium. Disorders of the heart wall. Endocarditis is the inflammation of the heart's lining, which is usually secondary to an infection elsewhere. Intravenous drug users and people with damaged heart valves are high risk for endocarditis. Myocarditis is inflammation of the heart muscle. It can be bacterial, viral, or fungal in origin, or can arise as a complication of other diseases like influenza. Pericarditis is inflammation of covering of the heart. The inflammation causes exudate cardio effusion to be released into the pericardial space between two layers of pericardium. This interferes with the heart's ability to contract and expand normally, which reduces cardiac output (CO) and leads to a life-threatening condition called cardiac tamponade. Cardiomyopathy is weakening of the heart's muscle that makes it pump inaccurately. Yeah. Cardiomyopathy is weakening of the heart muscle that makes it pump inaccurately. This causes the heart to enlarge, cardiomegaly, and lead to heart failure. Coronary artery disease. Coronary artery disease occurs when the coronary arteries supplying blood to the myocardium are constricted by atherosclerotic plaque and atheroma. This reduces the blood supply to the cardiac muscle. Platelet clumping can occur on the plaque and form a blood clot, otherwise known as coronary thrombosis. Atherosclerosis is the most common form of arteriosclerosis, hardening of the arteries, and it can lead to arteriosclerotic heart disease. Angina pectoris, pain in the chest on exertion, is often the first symptom of a reduced oxygen supply to the myocardium. Myocardial infarction, MI, is the death of myocardial cells caused by the lack of blood supply. Ischemia, when artery eventually becomes blocked, occluded. If the ischemia is not reversed within 4 to 6 hours, the myocardial cells die, necrosis. Shock is a life-threatening condition that occurs when the body is not getting sufficient blood flow. This can damage multiple organs. A classification of shock includes cardiogenic shock, occurs when the heart fails to pump blood effectively through the body's organs and tissues. Hypovolemic shock occurs from the loss of blood volume, often due to excessive blending, hemorrhage, or dehydration. Anaphylactic shock is caused by severe allergic reaction. Septic shock is caused by severe infection. Neurogenic shock is associated with damage to the nervous system. Cardiac arrest is sudden cessation of cardiac activity that results from anoxia, lack of oxygen in the body tissues. Most patients show asystole, no heartbeats, on the cardiac monitor. A person in cardiac arrest has no pulse and is not breathing and can be referred to as a pulseless non-breather, PNB.